Welcome back. It's Sheldon McLeod at SaltWire.com on Thinking Out Loud. And I wrote a piece today, and I was talking about working in newsrooms for years where the phone would ring and someone would say, "I hear sirens. What's going on?" And I used to joke that no one had ever called the newsroom to say, "I hear applause. What's happening?" And it's a real challenge right now to know what's going on with our healthcare system. We've been talking a lot about it, talking about what we missed years ago, what we should have implemented, perhaps what we could still do. And I got an email the other day that had asked me if I had heard of Kathy McNeil from Dartmouth and her book on healthcare. And she had managed the Dartmouth General ER for 5 years, an RN with 30 years service in Nova Scotia Health before she left. And to share with you a little bit about what the book was, it is Dying to be Seen, The Race to Save Medicare in Canada by Kathy McNeil. And Kathy McNeil is joining the conversation now from her home in Dartmouth. Kathy, it's so nice to see you. Thank you very much for joining me.
Thank you for having me, Sheldon.
Obviously, your background as a nurse, as an RN, gives you a perspective. How long has it been since you've been working in that field, first of all?
Well, I retired in 2016 from Northwood. I was a nurse manager there until 2016. And currently, I'm still teaching students through Eastern College. So I still hold a license and I still teach.
Now, we have been looking at the situation that's existing now, and some have said we saw this coming. We were told that the crunch was going to happen with human resources, with an aging population that combined with the numbers of baby boomers or nurses who would be retiring almost en masse at the same time. So is that a fair assessment that we should have seen this coming?
Absolutely, Sheldon. All the red flags were up. Certainly people working at the bedside tried their level best throughout the past 20 years, and I would dare say it's 30 years in the making. And they tried. Doctors, nurses, advocates, families, patients, you name it. We've been saying this for the past 20 to 30 years.
I have to admit, I would normally read the book before I speak with its author, and I have not had a chance to read more than what's available online right now to give me a sense what this book's about. And in a lot of ways, I think before we start talking about it, I think I have to ask you, how do you define neoliberalism?
So neoliberalism is the current political economy that we find ourselves in, Sheldon, actually that the world finds itself in. And what it is sort of runaway capitalism, dead-end capitalism that says really the corporate world has to control everything. And in that type of world, it has a little room for any public systems like public education systems and particularly public healthcare systems. So on a broader picture, we find all our public healthcare systems involved in this neoliberal ideology. The NHS in the UK is no different. Read a lot of articles doing research for this book where they are in the exact same position we are. Their services are being privatized out. Corporate entities are taking over where public services once were. And so on a larger scale, that is a real concern.
Kathy, I want to hear your thoughts, though, where in Ontario, the premier there said, we want to get people in front of healthcare providers quicker. It doesn't matter who's paying. It's not out of your pocket. You're not using your credit card. And the Prime Minister, Justin Trudeau, seems to be saying, well, let's see how it works out. He's not saying no. And I suspect that will crack the door open for other jurisdictions to perhaps follow that model. Why, from your experience, would that be a bad thing?
So I honestly believe from the research I've done, certainly the past 4 years of research, that every single shred of empirical evidence demonstrates that when you introduce duality into a public healthcare system, that public system, which is what I'm concerned about, Medicare, deteriorates further. So you ask, well, how can that be? So I would ask listeners to consider this. If you're in a jurisdiction and you have a hospital that's way over capacity and everybody working there is working to their maximum scope and they're still stressed, and you have, let's say, 100 nurses, 50 physicians, and maybe 3 physiotherapists. And somebody comes along and says, I have an idea. The hospital in our jurisdiction is overrun. I'm going to put a clinic down the street, and I'm going to take a proportion of patients who can pay out of pocket. I'm going to move them to the clinic, and that will unload some of the stress on your public hospital. So in order to do that, they're going to have nurses and physicians and physios. Let's say they do a lot of orthopedic surgery at our imaginary hospital and clinic. So they pull 20 nurses, and they pull 10 physicians, and they pull 2 of the 3 physios. What do you think happens to the public hospital that's now been depleted of staff to move to the private clinic? I'll come back to that. By pro-privatization forces would say, hey, we've taken a load of patients away from you. So we may have decreased your staff, but we still have taken a load of patients away from you. But as my old political science professor used to say, but here's the sticky wicket with that. The people who can afford to pay out of pocket are in the minority. So they've taken a small amount of wealthy patients or people who have means, they've moved them outside the public system. They've left the majority of patients in the public system and stripped that system of vital human resources.
When the Prime Minister of Canada doesn't step up or step in to a proposal that is exactly as you described it, how does that make you feel about the direction that the public health system in Canada is moving?
To be quite honest, when I read Justin Trudeau's statement on that, I was both disappointed and very, very concerned. I was also very pleased now that the book is out there, because I think if Canadians read it, they will see that may not be the right direction to go in. The book is filled with a lot of evidence-based research, a lot of data. I think there are something like close to 500 citations in that book. And pertaining to the public-private parallel systems, there are a lot of clear examples. One of the best examples that I found doing my research was from Ontario's own Dr. Bob Bell. And Dr. Bell's former Deputy Minister of Health, a CEO himself at one point, a physician. And he placed an article. He wrote an article, I think it was July of 2019, if my memory serves me correct. And it reads something like, does hybrid healthcare improve public health services? Lessons learned from Australia. So Dr. Bell and his co-author, Stefan Subarina, do a brilliant job laying out, since 1997, Australia has embraced this dual system, introduced this hybridity into their public system. And for public beds, the utilization of public beds and for wait times for public patients in public beds has done nothing but go up. And currently, for the surgical categories of cataract extraction, hip and knee replacements, and coronary artery bypass surgery, patients in public beds have longer wait times in that Australian system now than Canada. So that speaks to the deleterious effects that privatization or that duality has on the public system. And that's where my concern is the public system.
We do have access to private treatment if you have the means, and some of the services are being farmed out, or perhaps that's not the best way to say it, but that you can go to a private clinic, and cataracts are one example. The Premier has opened up that capacity to try and get more people through the system. So we're already seeing the door has been cracked open.
Yes.
But I don't know that your book, and I apologize for not having read it yet, talks about travel nurses. And that's kind of a different angle or a different side of this, which is the privatization of the human resource. And when speaking with CEO Karen Oldfield, she said she was at a public event in Yarmouth where apparently a travel nurse showed her paycheck to her other colleagues. And it's very demoralizing. And it's very much, I don't know how we see our way through a system that is so under capacity for human resources and overcapacity for treatment. How do you then fix what's broken without creating another problem?
So that's a loaded question. And I would say Premier Houston is in a pretty unenviable position. But I think what voters have to understand, and all patients have to understand, that this was 20 or 30 years in the making. And in all fairness to whoever's in the premier's chair at the moment, that system is not going to be fixed within an election cycle. You know, there are some people are saying, okay, well, you've been elected a year and you haven't done anything. I mean, really, I don't even know how to respond to that. This is a completely disintegrated system. It's not going to be fixed in a year, and it's certainly not going to be fixed within a one-term election cycle. And I know some of the stories have been horrific, but we have to keep focused on what to do and direct our energies towards how do we fix it rather than we want it fixed yesterday. Because we all, if we could wave a magic wand, certainly nurses, that's what we would want. But that isn't going to happen because it's disintegrated to such a degree.
And to be fair, the premier said it's going to be expensive and it will take longer than the one term, you know, in essence saying, I'm going to need 2 terms to do the work. Okay, so what are the fixes? I'm sorry to put that on you, but, you know, if you're
Sure.
If you're showing or shining a light on where the failures or the failings are, what suggestions can you offer us, Kathy?
So in the book, I break down solutions for the federal government, the provincial government, and for us as the funders of the system, what we can do right away. And for the federal government, one of the things they must do, in my opinion, is shift the culture of healthcare to a sort of a well-being economy. Now, there's a well-being economies government group, and it consists of 5 countries now. I believe they are Scotland, Wales, Finland, Iceland, and New Zealand. And what they are saying is, let's take the focus of GDP and money and mass consumerism and try and figure out where those GDP figures are falling in terms of what kind of society we create and what it does to the health of the nation. So one of the things I call upon the federal government to do is to join the well-being economies group. Culturally, that will shift the change to, we as a federal government, we are interested in the health and welfare of the nation. The other thing I ask them to do is to end the fiscal food fight with the provinces and territories over money, even if it means sitting down individually and doling out those Canada Health transfer dollars to each jurisdiction and tailor it to the needs of the 13 provinces and territories. But whatever way they do it, again, it's such wasted energy when we hear the premiers of the provinces and the territories, you know, fighting with the federal government and the federal government fighting with them. We need to harness that energy collectively to fixing the system. So they've got to do that. They've got, as the federal government, to take the bull by the horns and be the leader there. I see signs of some of that starting. So increase Canada Health transfers, apply strings to that, tailor to each demographic in the province. The other thing that they can do is try their level best to keep an eye on what's going on with the privatization situation in the country. Again, a little bit disappointed with Justin Trudeau's recent remarks. Has the federal government certainly put supports in for poverty? If there's one disease that I really worry about, it's poverty. So we have to find social supports for healthcare, all those social determinants of health. Quickly, for provincial governments, again, they have to end the fight with the provinces. Accountability for dollars is a major issue. We just read the release of Auditor General Adair's report, where she was talking about these additional appropriations. So apparently when it comes to the Finance Act, our province is an outlier. Over the past 10 years, there's been $4.7 billion of money given to departments once they exceed their own department money. It's just doled out without question, without a debate, without any discourse. And Auditor General Adair was really concerned about the transparency of that. And that has done nothing but grown. So in her report, she said I think it was 2012, 2013, there was a little over 200 million in additional appropriations. And by the time we reach 21, 22, those years, it's up to almost $900 million that's just given to departments when they use up their budget. We don't know where that's going. So there has to be some serious fiscal accountability. In the book, I suggest that we set out what's called FAIR councils, and FAIR stands for Financial Accountability Regarding Expenditures. And those councils come under the auspices of the provincial and territorial auditor generals. And then there is a similar federal FAIR council that those councils report to. So things like this, that there's a tighter rein on the finances. So that's one of the things I propose. Certainly expanding primary care. We have to expand primary care, and we have to set up and revolutionize healthcare. Healthcare services in our province, really, I don't see home care has a real home care service right now. When you have 80 and 90-year-olds that have to travel in the dead of winter to go to a lab to have their blood taken, or their adult children have to take a day off work to take them there, that is not a true home care system. So expand home care, make it more comprehensive, and make those services go directly to the people. And on an individual level, we have to find our voices as the funders. I list a whole list of resources, both federal and provincial organizations that are out there fighting for Medicare, Doctors for Medicare, bloodwatch.org, Canadian Health Coalition, provincial health coalitions. Join those organizations, read their literature, get involved.
You call it a race, and it sounds like you're worried time is running out.
Time is crucial, and the opening remarks in the book certainly spell that out. Time is crucial, and 2023 must be the year that we all come forward to rescue Medicare. And I'm still of the opinion that electoral politics alone will not do it. It hasn't done it in the past 30 years. We, as the people who fund the system at the grassroots, have to lead the charge.
There's a real challenge right now in a lot of ways for citizens to find their voice, because the feeling that the institutions are failing and that even our government is not as effective at trying to affect change. So,
absolutely.
Kathy, I really do appreciate having the time from you today, and we'll remind folks, if they want to pick up this book, Dying to Be Seen, The Race to Save Medicare in Canada, published by Friesen Press, and obviously available online at most of the places. I'm sure you can get it also in bookstores if they haven't already sold out.
Yes, and in Cape Breton, I can tell listeners, Sheldon, that probably the only place right now they can physically go and buy the book is at the Cape Breton Curiosity Shop on Charlotte Street in Sydney. My readers tell me that Chapters in Bears Lake may be getting a shipment in Monday, but I would advise listeners to call first.
Absolutely. Did we hit all the high points, Kathy? Do you feel comfortable that we've gotten the message across, the importance of what it is that you're saying?
Well, I think in every single poll, in every single time there's been an election, the primary driving concern for Canadians has always been their healthcare system. And there's a reason for that, because I think people espouse to the values and that our Medicare system displays. And I am someone who's been in the system 47 years, and I absolutely think it's a system worth saving. I think a lot of the disintegration has been deliberate. The book makes that case. There's a chapter called The Four Horsemen of defunding, defrauding, deregulation, and deliberate disintegration. I firmly believe there is money in the system to rescue it, and the book points out why that is and how we can change that around. All we need to do is to join forces collectively and demand that the system be changed.
Catherine McNeil, I thank you for your time today, and we wish the system well, and I hope that people hear what you're saying. So thank you.
Thank you, Sheldon.